So today we're going to be talking about the blood-brain barrier, what that is, why it's important, and why we need to know. So what is it affecting? So exchange of material in the body. The blood and the interstitial fluid are only across the walls of the capillaries. The capillary walls are formed by a single layer of endothelial cells. The blood is supplied to the brain through four arteries. You have your two internal carotid arteries, and you have your two vertebral arteries. These arteries merge and they form the circle of Willis, which is located at the base of your brain. Your brain requires 20% of your body's glucose and oxygen. However, your brain does not have a reservoir to serve this, to store this. So what that means is these need to be readily accessible to the brain for the brain to continue functioning. And the brain continuing to function is very important for your body to continue to function. If your brain doesn't have oxygen, in a matter of 5 minutes without it, you could be pronounced brain dead. So one of the things that your body has is something called neurovascular coupling, which allows for the changes in blood flow to the brain based on need. And to maintain this special homeostasis that's required to keep your brain functioning, you have something called your blood-brain barrier, which is also what allows for this neurovascular coupling, which will change blood flow to your brain depending on the brain's need. So your blood-brain barrier is highly selective. The endothelial cells are joined by tight junctions, which means that nothing is able to diffuse in between the cells. Everything has to be mediated by the cells itself. The material cannot pass between. These cells are the endothelial cells. Transport across the brain capillary walls between the wall-forming cells is anatomically prevented, and transport through the cells is then physiologically restricted. So this is very selective. It only wants what it wants going through. The purpose of this, again, is to maintain that homeostasis. So you want to make sure you have the correct level of hormones, the correct level of nutrients, the correct amount of water in the brain. Fluctuations in any of these could disrupt the finely tuned environment. And as you know, these levels are always changing in your blood, in your body, based on just what you're doing. Did you just eat a meal? Are you having a rush of adrenaline? And you don't want all these things to be impacting your brain, because your brain needs to stay at a certain level to continue to function correctly. So it's going to be protecting the brain from the chemical fluctuations, but also from pathogens. So any kind of bacteria or virus that might be in your bloodstream, in your body, you don't want it to be able to get into the brain, because again, an infection of the brain causing swelling, causing any kind of degradation of brain tissue, any interruption of your neural junctions. These are all things that can be extremely detrimental to the point of death in a person. So blood-brain barrier, extremely important to maintaining that. Movement. So although it is restrictive, obviously there still needs to be movement. So O2 and CO2 are going to diffuse based on the concentrating gradient. So these are going to diffuse passively through the cell. Small lipophilic molecules can passively diffuse across the lipid bilayer, but in many cases, they end up being returned back to the blood by something called efflux pumps. These are pumps that once these molecules pass into the endothelial cells, the endothelial cells kind of kick them back out before they let them get to the brain. And then you also have metabolic nutrients and other essential molecules, which are transported across the luminal and abluminal membranes by channels, pumps, or mediated transport systems. Here on the right, I kind of have a diagram that shows how it's getting from the blood into the brain. So, you have your channels, which are going to be your small ions in water. You have membrane transport. These are going to be a little bit larger molecules. Your larger molecules such as glucose, monocarbonates, lactate pyruvate, amino acids, these are going to have to be carrier mediated transports. Then you also have receptor mediated transport, absorption mediated transcystosis systems, and that active efflux transporter that I was talking about. And that's going to be something that is also actively pumping it out of the cell. So cells of the blood-brain barrier. So there are two very specialized cells associated. We have the pericytes and we have the astrocytes. So the pericytes are contractile cells. They wrap around the capillary endothelial cells. They lend to the structural support of these microvessels. They will signal with the endothelial cells to influence the permeability and the growth. The pericytes may also perform immune cell-like functions, such as sensing, engulfing, and destroying potentially harmful blood-derived microorganisms that are trying to cross that blood-brain barrier. And then you have astrocytes. These signal the cells forming the brain capillaries to kind of get tight. They're going to promote the production of specific carrier proteins and ion channels that regulate the transport of selected substances through the endothelial cells. They also participate in the cross-cellular transport of some substances, such as potassium. All right, so the blood-brain barrier is very good at what it does. So good that it actually creates issues for physicians that are trying to treat patients. So it doesn't allow anything through that it doesn't want, and it doesn't allow therapy through. So it, this is something the brain wants, but it doesn't know it wants it. So therapeutic antibodies have the potential to be highly effective in treating disorders such as Alzheimer's, multiple sclerosis, autism, and Huntington's. But they're just too large to cross that blood-brain barrier. There's also different pathogens, so meningitis, syphilis, AIDS, is all caused by microorganisms that are capable of entering and infecting the central nervous system. But again, it's very difficult to treat anything inside the blood-brain barrier because of trying to cross it. So most drugs that are in production cross by lipid-mediated free diffusion. So those are those tiny lipophilic molecules. It has to meet two characteristics to be able to cross. Those are, it has to have a molecular weight of less than 400, and it also has to have a high lipid solubility. Of over 6,000 drugs that are in the comprehensive medicinal chemistry database, only 6% of these are actually active in the brain and meeting those two criteria. So, although there is a criteria that can get it across, not many drugs actually meet it. So only these drugs treat, and of those 6%, only a select group of those are actually able to treat brain diseases. So one of the things that scientists have been working on is how can we get the therapeutic treatments across this blood-brain barrier? And they did come up with a few ways to do that. So you can use smaller drugs. So this is going to be sneaking them through the normal gateways for entry of essentials such as iron. For larger drugs, you could use a Trojan horse, so kind of hiding them within a substance that already has access. You could also temporarily shrink the endothelial cells via injection of a hyperosmotic solution. What that's going to do is it's going to draw water out of the cell, which then can create these minuscule gaps in the blood-brain barrier, which then, by pulling them apart at the tight junction. So as the cell shrinks, that space between them gets a little bit bigger and they can kind of try to sneak something through. And then the last is by injecting microscopic gas bubbles and using ultrasound to then vibrate them against a precise location of the blood-brain barrier, which will briefly force open those tight junctions in the bombarded section. And that's an example of what you see on the left side here. So the top image that's on the right side there is with everything intact. You have that blood-brain barrier. You see those microbubbles are on the outside. You have different treatment that's not able to get through because of those tight junctions. And then the bottom, so you have that focused ultrasound irradiation, it's going to vibrate those bubbles. Those bubbles then are going to be bouncing against the blood-brain barrier, which causes these openings, and then the drugs are able to get through. And then imaging. So we talk about the, being able to provide therapy treatments, but one of the other things that's important is being able to image the brain. So we want to be able to see what's going on. And although we can do CT scans and x-rays and MRI, those are more anatomical scans, and we need to also be able to see what's happening function-wise, physiology. What is the brain doing? Not just what does it look like. This is very important in things such as seizures, Parkinson's, dementia, Alzheimer's, where those tau and plaques are being able to image. So one of the things that they run into is, how do we get these imaging agents to cross the blood-brain barrier? So this is an example of a nuclear medicine brain perfusion scan. It uses a radioactive isotope called Neuralite. So this is important because it is used for evaluating if a patient is brain dead. So they're looking to see, is the blood flowing in the brain? But to be able to see the blood flow in the brain, they need to cross that blood-brain barrier. So Neuralite is actually a small lipophilic agent. So it is able to cross the blood-brain barrier by diffusing through. And once it's across, it's then hydrolyzed by an enzyme. This hydrolyzation causes the molecule to become hydrophilic. It's then able to cross back the blood-brain barrier again. So if the blood is flowing to the brain, into the brain, you would see the brain visualize. So the image on the left is the brain visualizing. You can see it becoming hotter as you see the blood flow up through those arteries. Circle of Willis hits, gets into the brain becomes nice and hot, which is that dark appearance. The one on the right, you notice you can still see it going up the arteries in the neck. However, it never actually perfuses into the brain, so this patient is brain dead. One of the things that made this important is, before a lipophilic agent was found, they were actually using an agent where they were just trying to visualize the superior sagittal sinus. So they were just basically looking for a line that came vertically down the coronal section of the face. People that weren't as familiar with how to read or weren't as sure, sometimes this could result in an inaccurate read, which, if you're calling someone brain dead or not brain dead, you want to make sure you're having an accurate reading. This is obviously much more obvious. You can tell, if I tell you that what you're looking for is to see this black circle in the middle of the brain on the left and not on the right, I could probably then have someone look at this and be able to say whether there is blood in the brain or there's not. So it kind of takes away that whole questioning and helps to get better diagnosis for the patients as well. And these are the references that were used to create this presentation. I hope you learned a little bit about the blood-brain barrier today. Thank you.